Okay, I'm from India, a country where internet is cheap. But on the other side, this is a lower middle income country also. And there is a huge gap between the rich and the poor. From your perspective, uh, how this actually makes India vulnerable to be, a capital of addicts, different kind of addicts, because you are mentioning about, different factors also that contribute to addictive behaviors. So, can you give a small analysis about, how India can be or Indians can be vulnerable to, being some kind of an addict,
Yeah, yeah. So, I mean, I think that the most vulnerable people on the planet today are poor people living in well-resourced countries. So, into my mind, that would include India, because it's a country that, although it has many people, and many of them are living in relative poverty, they still have access to the internet. So they have access to digital media, which is a drug, and it's free, right? They don't have to pay for that largely. And because of the worldwide supply chain, people now can really get drugs anywhere in the world. There's no place that's insulated from drugs. And the reason that poor people living in well-resourced countries are the most vulnerable is because they have less access to healthy sources of dopamine like clean air, clean water, and potentially sort of meaningful work that's attached uh, sort of to the effort that it produces. Very often they have to work long hours in menial jobs with little access to nature, sometimes little access to healthy foods. And as a result, they are very vulnerable to searching for cheap pleasures or drugs to sort of deal with the stress of poverty.
Mhm. So you're calling even the digital, pleasures available as drug, the same as physical drugs. So can you just give an idea of why you decided to, explore this connection between dopamine and mental health? Because from the outside, it may seem them why a psychiatrist is, concentrating too much on dopamine, which is something that gives, pleasure, and that's the idea we may get. But can you just tell us if there is some, uh, you know uh, uh, some personal anecdote also that you can share, that made you to explore this whole area.
Sure. So, I've been treating people with severe addictions to drugs and alcohol for many decades now, starting about 20 years ago with the advent of the smartphone. I started seeing more and more people coming in with what we call behavioral addictions or process addictions. These are addictions to behaviors rather than substances. And almost universally, these individuals said that it was the internet and especially the advent of the smartphone with its 24/7 access that tipped them from recreational use to maladaptive addictive use to online pornography to shopping to video games to social media. And then at one point, I recognized in a certain patient of mine with a very severe online pornography and sex addiction, I recognized some of my very own behaviors as addictive behaviors that I hadn't previously really been aware were in the same category. Namely, I got addicted to romance novels. And like my patients, for me, what really tipped me into more addictive behaviors was the technology, and in particular, the advent of the Kindle, which allowed me to read books one after the other very cheaply, anywhere, anytime, in secret, anonymously. And over a period of about a year and a half, I essentially escalated from kind of tame romance novels written for teenagers to hardcore porn. um, in a novel form, right? So what we call erotica. Um, and of course, my compulsive behaviors were not life threatening. So I wouldn't want to, underscore the life threatening nature of the addictions. I wouldn't want to, let me see, how can I say this? I wouldn't want to minimize the life threatening addictions of my patients, to drugs and alcohol, and in some cases to behaviors. But what I'm trying to do is to highlight that this is a spectrum, and we all have the same basic brain reward pathway that reflexively seeks out pleasure and avoids pain. And in the context of unlimited access to our drug of choice, whatever it may be, we're all vulnerable to some form of compulsive overconsumption, otherwise known as addiction.
So, as a psychiatrist, would you say that pain is also good? Like human human behavior is not to seek pain, but to seek pleasure. But do you think that pain is also a balancing factor?
The argument I'm trying to make is for a modern form of asceticism.
Hmm.
And the reason I think it's necessary is because we have so insulated ourselves from many different forms of pain, including just simple physical exertion, right? Many people in wealthy and emerging economies hardly even move their bodies anymore, right? So it's not even that we don't experience physical pain, many of us, we don't even experience our bodies. Plus, at the same time, we have access to all of these reinforcing substances and behaviors. Almost everything has become drugified in the modern world. What do I mean by that? I mean, it's been made more potent, so it releases more dopamine in our reward pathway, more accessible with digital media. It's 24/7 wherever we go. It's been made more novel, and novelty is a key trigger for dopamine. And it's been made more bountiful, so TikTok never runs out, right? And so, therefore, because we're living in this dopamine overloaded world, I think we need to intentionally seek out difficult things and
Hmm.
even painful things as a way to strike a new balance in a time of unprecedented convenience and comfort.
Hmm. I want to go back to your last question's answer. You were saying that you're not comparing drinking or alcoholism with, you're not or not trivializing alcoholism or drug abuse or addiction. But can you just make it compare this between the dopamine high one would get from an activity like drinking or taking drugs to an activity like compulsive shopping or online scrolling?
Right.
Also,
Yeah.
I just wanted to know whether you use the same kind of techniques when it comes to treating drug addiction and digital drug addiction.
Right. So let me just say, what I was trying to say was that I wouldn't want to trivialize the severe life-threatening addictions of my patients by comparing it to my relatively minor addiction to romance novels. However, I have patients who are as addicted to behaviors as I have some patients as addicted to behaviors as others are addicted to drugs and alcohol. So people can develop life-threatening addictions to behaviors like gambling and sex and online activities like video games, shopping, and social media. So these are very real addictions. They can be very severe. They can take lives. Um, when we're looking at the natural history of the disease process of addiction to drugs and alcohol and comparing it to addiction to digital media, it looks exactly the same. People start out using for one of two reasons: to have fun or to solve a problem. If it works for them, they will return to using that substance or behavior. Over time, their brain will change such that they need more of the drug in more potent forms to get the same effect. So, for a pornography addiction, that might look like starting out with relatively generic visual images and progressing over time to more deviant, violent, and maybe even illegal
Mhm.
pornographic images as a way to overcome tolerance and neuroadaptation. And I've even had patients who, have wanted to end their own lives because of their gambling addiction, their sex addiction, their internet addiction. So these are very serious addictions. They're non-trivial. Digital media is a very potent stimulus. So let me just say that this technology has many wonderful things and many benefits, and there's much good, but there's also this dark side, and we need to really respect that moving images are very potent for our brain's reward pathway, especially if we're talking about moving images that also involve the exchange of socially important interactions between humans. So, for example, things that validate our emotions or elevate our reputation with others. Simply getting a like or a thumbs up clearly activates the brain's reward pathway. So, moving images on TikTok, likes, shares, um, experiencing an emotion at the same time that somebody else is experiencing an emotion on the internet. All of that is highly reinforcing and activates the brain's reward pathway and hence can be addictive.
Hmm. And I just wanted to know whether you employ the same techniques when it comes to,
Yeah, you
treating.
asked me that. Sorry. Yeah, so that's really kind of the innovation is that we about 20 years ago, we gently started using the same interventions that we use for drug and alcohol addiction to process or behavioral addictions like sex addiction, gambling, pornography, shopping, video games. That intervention starts out with an early intervention of the dopamine fast, trying to abstain from the drug long enough to reset reward pathways. But also, we use very similar things like some of the medications that we're using to treat drug and alcohol addiction. We're now using to treat the behavioral addictions with good effect. Um, 12-step groups like Alcoholics Anonymous have been proliferating for decades now to treat things like gambling addiction. So, Gamblers Anonymous, Sex Addicts Anonymous, Video Game Anonymous, Internet and Technology Addicts Anonymous. These are peer recovery groups that have been forming all over the world so that people with an addiction can help other people with the same addiction. So, yeah, the interventions, the treatment is looking pretty much identical.
Mm. So, since this dopamine is something like a neurotransmitter, uh, so there must be some kind of an involvement from the neurologists also, right? In developing new kind of treatment methods, and so is there any mechanism by which you have some kind of collaboration with neurologists and some other kind of areas or domains, to developing new kind of techniques to treat addiction problems.
Well, I mean, we're always looking for new and innovative treatments. So, for example, but I wouldn't say it's over in neurology. I mean, this is the work of I'm a psychiatrist, an MD psychiatrist. This is the work of other psychiatrists as well. So, things like transcranial magnetic stimulation is being applied to the brain. This is magnets applied to the brain at certain frequencies and certain directions to create electrical currents in specific regions of the brain to help with addiction. And so we have good data for transcranial magnetic stimulation helping people with smoking addiction, cigarette or nicotine addictions. Um, there have been there's been work done looking at things like deep brain stimulators that are inserted in the brain to activate certain nuclei and deactivate others as a way to help people with addiction, including things like gambling addiction. Interestingly, since you ask about neurology, um, Parkinson's disease is a movement disorder caused by a depletion or an abnormal loss of dopamine in the substantia nigra. It's often treated with a dopamine precursor called L-DOPA, which is then converted to dopamine in the brain. And in about a quarter of Parkinson's patients who receive this L-DOPA, this dopamine precursor, they develop a de novo addiction, often to things like sex and gambling and shopping, which
Mhm.
is dose dependent, and which, when you take that medicine away, it often resolves spontaneously.
Mm.
So there's some interesting overlap there.
And what are some of the common misconceptions about addiction that you encounter in your practice? And also, can you share a trickiest case of addiction that you had to treat?
Okay. So a common misconception about addiction is that it's not treatable, and that once people are addicted, there's really nothing that can be done, and certainly no role for the physician. But in fact, when you treat addiction like a chronic relapsing and remitting medical disease with a behavioral component, you actually get response rates that are on par with the response rates we see when we treat other chronic illnesses like obesity, certain forms of heart disease, asthma, depression. So really, we have good response rates, and there are millions of people all over the world who are living in long-term recovery, decades-long, lifetime-long recovery from severe addictions. And people can get into recovery at any stage of life, even after decades of addictive behavior. So there's a lot of reason for hope. Um, I'm sorry, what was the second part of your question? You said
One
common.
trickiest case where you had.
Oh, I would say, I mean, perhaps the trickiest case was a patient of mine a woman who had been addicted to alcohol and then got into recovery from her alcohol addiction. But one of the dangers in recovery is what we call cross addiction, where people take that addictive pattern and they switch to something else. And believe it or not, she got addicted to water.
Water.
She water. So she
Okay.
discovered that if she overconsumed water, so if she drank a lot of water, she would become hyponatremic, which would create an altered mental state, which wasn't, exactly the high that she got with alcohol, but which was sort of close enough. And again, a lot of the thing about addictive behavior is the control piece, wanting to know that there's this substance or behavior we can use that will change the way we feel. So she would then periodically overdrink, become hyponatremic, become mentally altered, and then end up in the hospital. And hyponatremia is a very unstable and dangerous condition. So that was really tough.
Mhm. So the treatment method for this was also the same, no? Like just how
Well,
you
yeah, I
had.
mean, the treatment was to try to encourage her to moderate her water consumption, not to consume, and to drink maybe not plain water, but also electrolytes, but more try to get at the sort of the deeper pattern
Mhm.
of addiction, try to avoid that behavior and try to find other healthier adaptive coping strategies.
Yeah. So about this coping strategies, can you just elaborate on these concepts of self-binding and dopamine fasting, and how
Sure.
these can help people manage their addictive behaviors?
Yeah. So, I mean, dopamine fasting is figuring out your drug of choice and trying to give it up for 4 weeks to reset reward pathways, knowing you're going to feel worse before you feel better. This is an intervention that we don't recommend if you're at risk for life threatening withdrawal from, let's say, opioids or benzos or alcohol. For that, you should go to a hospital and get a medically managed detox. But most people, although it's difficult to give up their drug of choice, they can do it without serious medical consequences. And if you can do that for 4 weeks, at the end of that time, most people feel much better
Hmm.
and begin to be able to get their frontal lobe talking to their limbic brain to make better decisions about their lives going forward. Sometimes people want to continue to abstain, but sometimes they want to go back to using, but using in moderation. And then we talk very specifically about that, what that looks like. In the older sort of addiction lore, the idea was, well, you could never go back to using. But really, we do see some people with milder addictions who are able, with a lot of planning and discipline and guardrails in place, they are able to go back to, for example, drinking alcohol in moderation. Although, again, I emphasize it's a small minority, it's difficult. And that really requires what we call self binding, that is, not relying on willpower alone, because once we're in the throes of desire, it's really hard to resist the craving. And so self binding strategies are ways of creating both literal and metacognitive barriers between ourselves and our drug of choice to help us press the pause button between desire and consumption. So, for example, if you were addicted to video games, you gave those up for a month, your craving would get better and it would get easier with time. If you decided you want to go back to playing video games, you might decide, I'm only going to play on Friday and Saturday. I'm only going to play 2 hours a day. I'm only going to play with my friends, never with strangers. I'm not going to play game X because that I can't control, but I will play game Y. And I'm going to keep a very meticulous record of what I do so that I can be accountable to myself and others. And maybe I'm going to meet with somebody weekly or monthly to report to them how I'm doing, another way to be accountable. So these are all, self-binding strategies. For alcohol, it might be never having alcohol in the house, making sure that you don't go to an event where alcohol is going to be shared. Maybe it would be something like taking a medication like antabuse, which makes people violently ill if they drink. And taking that before going up into a risky drinking situation. So things like that.
Mhm. So, do you think that this dopamine imbalance and related mental health specter is something that psychiatrists alone cannot solve? Because I'm asking this from the context of existence of a dopamine economy, or what do you call limbic capitalism? Is it
Right.
that kind of an economy or this kind of a capitalism the main culprit here? Uh,
Yeah.
and can you just explain whether prohibition on a large scale, from the government level of certain kind of drugs or alcohol, or certain things like that, the best way to deal with this kind of large scale issue for a country or a state?
Yeah. Well, I think what's important to recognize is that our brains are not just in our heads. Our brains are an embodied extension of the environment that we live in. And if we live in an environment where feel good drugs and behaviors are readily accessible at the touch of a fingertip, we're all going to be vulnerable to the problem of compulsive overconsumption. You could make the argument that in a successfully capitalist system, we would all be addicts, right? That the ultimate form of successful capitalism is to turn us all into addicts. So, what we need is capitalism with guardrails, right? Where we recognize that given infinite access and the unique wiring of our brains, which were evolved for a world of scarcity, not for the world of abundance that we live in now, um, that we have to really help each other limit access. We can't just leave it up to individuals to solve this problem in a world of abundance. Families, communities, governments, companies that make and profit are all responsible for helping with top down limitations. What you say prohibition, prohibition in the United States between 1920 and 1930, when the importation, sale, and dissemination of alcohol was outlawed in the United States. Most people associate that with speakeasies and a black market, but in fact, during that decade, alcohol related to liver disease and public drunkenness decreased by half and continued to remain lower for decades afterwards. So, access really is one of the biggest risk factors for addiction. And if you live in a time and place of unlimited access to your drug of choice, you're more likely to use it and more likely to get addicted. The
Mhm.
opioid epidemic in the United States was a great example of that. The opioid crisis in China in the early 1900s, when we flooded China with opioids and they had their own epidemic, as an example. So I do think there are. It, I wouldn't want to say that in every country, in every context, I know the answer. It's not that. And obviously, we have legal drugs that are just as deadly, like alcohol and nicotine products, as illegal drugs. So there's a bit of a conundrum here.
Mhm.
But at the end of the day, we need to acknowledge it's not just, we can't just rely on our individual willpower or our individual guardrails. This is really a communal process, and we have to work together both with bottom up and top down interventions to protect ourselves from our own tendency toward compulsive overconsumption.
Yeah, one last question, Doctor. So this is about, now we are going into a world where this uh, VR and AI is also making a lot of new kind of digital drugs. So what are the kind of scenarios that you see emerging, in the coming decades?
Yeah, well, in some ways, VR is just sort of a more potent version of what we already have now. It's not surprising that people are investing in it, because as we all get bored with the level of stimulation we have now, we're going to have to keep going to the next level and the next level. But what we know about how the brain works is that no matter how far we go, we will eventually get bored again. and then also, be addicted, which is to say, have trouble stopping even when we want to and even when we know it's harming us. So one of the things that, this gets into very sci-fi stuff, but as AI develops and starts to generate these deep fakes and these bots, I wonder if there's going to be a point at which we humans will actually become either so addicted to this cycle that we will literally cease to engage with reality and therefore ultimately perish, or whether we'll somehow find a way to get the AI to get addicted to itself, and then we will disengage and reinvest in the real world.
Mhm. One last question. I just forgot to ask you, but this is a very important question, I think, because now children are also like being exposed to digital devices at a very young age. I see, like many of my friends now, they have children, so they put up, phone in front of the child to, feed them. All those kind of things that we can see. So, how does in this early exposure to children and kind of an imbalance of dopamine that happens at a very
Yeah,
young age affects the
yeah.
individual.
I mean, I think I think we should be very, very careful about exposing children to these digital drugs because they really are drugs, and they change our brains. And they're so cognitively adherent and so reinforcing that a child who is repeatedly exposed to that they will change their pleasure or hedonic set point such that they will not have frustration tolerance to work through problems, or to patiently sit in the quiet and come up with their own games, and their own original ideas. They'll become progressively more inattentive, more demanding, more impatient, less able to tolerate distress. And I mean, I understand why parents do it because it works really well. It's the best babysitter in the world. But I really feel that a child under the age of 13 should not have access to their own device. And their screen time should be greatly limited to no more than about an hour or two per week, and then heavily supervised.